Are you feeling pretty confident with what we covered so far? Okay, so that's easy. That's pretty straightforward stuff. So I guess what I'll do is I'll just stay sitting here, and that probably gonna be the easiest because I'll leave the normal values up, and maybe I'll just get rid of the PaO2 and the SaO2. There we go. Okay. Let's go ahead and let's do okay. Here we go. So pH 7.33. Acid, base, normal, acid, normal, base, normal.
Acid.
Everybody's okay with that? That this is acid? Good. All right. Let's move down. pH, CO2. Acid, base, normal, acid, normal, base, normal.
Acid.
Acid. Okay. Okay. Bicarbonate. Acid, base, normal. It's base, isn't it? Okay. Okay, so far so good, right? So next step, what is the primary problem? My primary problem is an acidosis, right? Okay, so let's put that acidosis. All right, what is the cause of that acidosis? Respiratory, right? So we've got respiratory. So then the next thing, we go, well, did his buddy jump in and try to help?
Yes.
Did he help? Yes or no? Did he help? Yes, because he's outside the normal range, right? He's 27, right? So he is helping. That base is trying to neutralize the acid, right? But is he getting the job done? No, they're both getting their asses kicked, aren't they? Right? So when you jump in, when your friend jumps in and still can't get the job done, we call that not decompensated. No, because he's trying to compensate, right? We call this partially compensated. All right? There is partial compensation, but because the pH is still abnormal, it's not fully compensated. Does that make sense? You guys cool with that? Okay, cool. Well, let's do another example here. All right. So let's do... Okay, so step one. What's the pH? Base. Would you guys agree? Right? So it's base. Okay, step two, let's find out what's causing that abnormality, right? So, PaCO2, acid, base, normal. Base. Good. Bicarbonate, acid, base, or normal?
Acid.
Acid, remember Rome, right? Are you guys okay with that? That this is an acid? Okay. Okay, what is the underlying problem? Alkalosis. What's the cause of the alkalosis? Respiratory, right? So we've got a respiratory alkalosis, right? Next question is there any compensation going on here? Yes, right? He's trying to help, but is he getting the job done? No. So what kind of compensation is that? Partial compensation. Good. Partially compensated respiratory alkalosis. So far, so good? Makes sense? All right, good. All right. You guys okay there with that? Making sense so far? Okay, well let's move on. do this here. Okay, so pH. Acid, base, normal, acid, normal, base, normal, totally. This is what? It is acid, what? Normal. When you have a pH that is acid normal or base normal, there may or may not be an underlying problem. Okay, there may or may not be an underlying problem. So, let's move down and see if there is a problem. What's the CO2? Acid, base, or normal? It's acid. Okay? Okay, what's my bicarb? Acid, base, or normal? Base. So is there a problem? Yes. What is the problem? There is an acidosis, and what's causing it? Respiratory. So would you guys agree that there is a respiratory acidosis? Okay. There is a respiratory acidosis. All right. So far, so good? Is the buddy helping out? Yes or no? Okay. Is the buddy getting the job done? Yes, because the pH is in the normal range. Does that make sense? So, we would call this a compensated respiratory acidosis. You guys okay with that? Now what I'm going to do is I'm going to change this one up slightly. Let's say instead of 57, we had a pH of 42, or a CO2 of 42, and instead of 28, we had a bicarbonate of 23. Okay? So my pH is acid normal, right? My CO2, acid, base, or normal? It's normal, right? You guys agree? It's normal. Okay. My bicarb, acid, base, or normal? Normal. So now the question is there a problem? No. Because everything else is normal, right? So we would call this a what? A normal ABG, right? Even though this is in the acid normal, both respiratory and metabolic are in the normal range, so there's no problem. Does that kind of make sense? But if one or the other was abnormal, then we would have a problem, right? Does that kind of make sense there? Okay, cool. Well, let me give you guys some more examples then. pH. Acid, base, normal, base, normal. Acid, what? Normal, good. Okay. CO2, acid, base, or normal? Acid. Okay. Bicarbonate, acid, base, or normal? Base. Okay, good. All right, so is there a problem?
Yes.
What is the problem? Good, a respiratory acidosis, right? Those two line up. Is the friend helping out? Are they getting the job done?
Yes.
Because it is in the normal range. So we would call this a compensated respiratory acidosis. Okay, so just another example of, okay, good. All right, let's do this then. There we go. All right, let's look at this one here. So, pH, acid, base, normal, acid, normal, base, normal.
Base normal.
So this is base, normal. Okay, good. CO2, acid, base, or normal? This is acid. Good. Bicarbonate, acid, base, or normal?
Base.
Base. Okay. Do I have a problem?
Yes.
Yes, right? I've got a base here and a base here. Those line up. So this is a metabolic alkalosis, right? You guys cool with that? So I've got a metabolic alkalosis. You guys make sense? Did the buddy jump in to help out? Yes. Is he getting the job done? Because it's in the normal range, so we would call this a compensated metabolic alkalosis. Does that make sense? So far, so good? How's the confusion level? Is it pretty minimal so far? Okay, good. Huh? Yeah, good, good. And then what happens is I'm going to put a worksheet in front of you guys and you'll be like, what? I don't get it. All right? It always, at least that's my experience, it's always like, oh yeah, this makes sense. He's going through it and then, oh, I have to do it on my own? But what's going on here? All right. Let's do a couple more.
Thank you.
Okay, here we go. So pH, 7.42. Acid, base, normal, acid, normal, base, normal.
Base normal.
This is base, normal. So there may or may not be a problem. Okay, CO2, acid, base, or normal?
Base.
Base, okay. Okay, bicarbonate, acid, base, or normal? This is acid. Is there a problem?
Yes.
What is it?
Metabolic.
Good, it is what? Alkalosis. What is the cause of the alkalosis? Right? Do you see how drawing this out helps? Right? This is base normal. Oh, I've got a base here, right? They connect. Does that make sense? So the problem is a respiratory, right? Alkalosis. You guys cool with that? Let's look at the buddy. Is the buddy helping out? Sure is, right? Is he getting the job done? So we call this a compensated respiratory alkalosis. You guys cool with that? Okay, well, let's do another one here. Okay, so pH, acid, base, normal, acid, normal, base, normal.
Acid.
It's acid. Good. CO2, acid, base, normal. Bicarbonate, acid, base, or normal? Okay, what do we have going on here?
Acidosis.
Okay, so the underlying problem is still acidosis, right? Okay, what's causing it? Respiratory and metabolic, right? Both of these line up. So when you have a case like this where all three are the same, this is what's known as a mixed problem. So we call this a mixed or combined acidosis. This is a very sick patient, right? It's a very, very sick patient. Occasionally run into it, right? You guys cool with that? All right, so now what I'm going to do is I am going to give you guys a few different disorders. Okay, I'm gonna give you guys an anxiety attack. Okay, I'm going to give you guys pain. And I'm going to give you guys an opioid overdose. These are the three possible problems that could be going on with the patient. Okay, I'm going to give you these problems. All right. And I'm going to go and give you an ABG. So we draw an ABG. So let's start at interpreting the ABG first, okay? So, pH, acid, base, or normal? It's acid. All right. PaCO2, acid, base, or normal? You guys okay with that? Acid, base, or normal for the CO2? Acid, you guys good? Okay, good. Good. It's elevated. Bicarbonate, acid, base, or normal? 24. Is it bicarbonate?
Perfect.
Normal. Okay, good. Normal. Okay, so is there a problem?
Yes.
Yes. What is a problem? It's what?
Acidosis.
Okay, good. Acidosis. Good. Okay. What's the cause of the acidosis? Respiratory, right? And is there any compensation? Negative, right? This is normal. So there is no compensation. So uncompensated respiratory acidosis. Okay, so these are the three problems that this patient could be experiencing. Which problem do you suppose would be most likely given the patient's ABG? Well, let me ask you a question. What is happening in patients that are having an anxiety attack? What are they doing? They're breathing very rapidly. So let me ask you, what would you expect the CO2 to be in someone having an anxiety attack? You'd expect it to be low. What would you expect the pH to be? Yeah, an anxiety attack, you'd expect a low CO2 and what kind of pH? A high pH, right? You would expect a respiratory alkalosis with an anxiety attack, right? So guess what? Do you think that anxiety attack is a likely answer here? Probably not. Well, let's move on to pain. Okay, and no other problems. I'm just saying that pain is okay. What would we expect with pain?
They could also be.
Probably the same thing, right? An elevated respiratory rate, so they're going to blow off CO2. Okay. What would you expect with an opioid overdose? Decreased respiratory drive, hypoventilation, which is going to do what to the CO2? It's going to drive it up. And if the CO2 gets driven up, what's going to happen to the pH? It's going to get driven down toward acid. So this ABG would fit an opioid overdose, right? And we know that the kidneys are not compensating here, right? Which means that this is something that is fairly acute, right? This has not been going on for a long time. Certainly not hours or days. So everything would point to an opioid overdose, right? And this is actually a classic kind of ABG that you find with someone who's overdosed on an opioid or some sort of depressant. Would be an uncompensated respiratory acidosis. Make sense? Okay, cool. Well, let me do this here. Let me give you guys some more. So I've got stable COPD patient, so this is somebody who is not having an exacerbation, right? They just have a history of it, an opioid overdose, or an anxiety attack. Those are the three problems. And then let me give you an ABG here. Oops. Okay. So let's start with the ABG first. pH. Acid, base, normal, acid, normal, base, normal. Acid, normal. Okay. PaCO2, acid, base, or normal? Acid. Okay. And then bicarbonate, acid, base, or normal? It's 28. Base? Do you guys agree? Okay, good, base. Okay, so what's the underlying problem? A respiratory acidosis. Good. So I've got a respiratory acidosis. Is there compensation?
Yes.
What kind of compensation? Is it fully compensated or partially compensated? It's in the normal range, right? If it's in the normal range, then it is fully compensated. So compensated respiratory acidosis. You guys cool with that? So let's look at our problems here. Anxiety attack. No, we would expect an uncompensated respiratory alkalosis, right? Opioid overdose.
Wouldn't be compensated.
Oh yeah, because an opioid overdose happens very quickly, right? You know, if you inject a bunch of heroin, this is going to happen within minutes, right? So you wouldn't really see compensation. Stable COPD. Yeah, right? This is somebody who has chronic obstructive pulmonary disease. Yeah. So a compensated respiratory acidosis is a classic finding in a stable COPD patient. They're compensating. This has been going on for a while. Does that kind of make sense? Okay, cool. Well, let's do this. Let's do this here. So I'm going to give you guys CPR. So this is a cardiac. Someone's been doing CPR on them. Let's do stable COPD. Okay, and then we'll do COPD exacerbation. Okay. You guys go with that? Okay, so let me give you guys an ABG here. Okay, so let's start at the pH. Acid, base, normal, acid, normal, base, normal. Acid, you guys cool with that? 7.32, so it's a full-on acid. Okay, let's look at the PaCO2, acid, base, or normal? Acid, CO2 60. Okay. Bicarbonate, acid, base, or normal? Base. Okay, good. All right. So, is there a problem? What is the underlying problem? It's an acidosis, right? What's causing the acidosis? Good. So this is a respiratory acidosis. And is there compensation? The answer to compensation is this changing in the opposite direction, right? Not is the pH normal. That is not the answer to compensation, right? It is the bicarbonate changing? Yes or no? Why yes or why no?
Because it's not within normal range.
Right. What's the normal range for bicarbonate again? 22 to 26. What is the bicarb here? 29, right? So this is compensating. Would you guys agree? You guys okay with that? Right? It is more basic. It is attempting to neutralize that acid. The question is it getting the job done? No. So what kind of compensation is that when you can't get the job done? Partially compensated. Good. So partially. Does that make sense why this is a partially compensated respiratory acid? Okay, cool. So let's move on. Let's see, CPR. Could this be someone in cardiac arrest?
Yes.
Probably not, right? Because we got compensation here, right? How long does it take for renal compensation? It's a long time to be in cardiac arrest. Okay. So no, probably not. Stable COPD.
Yeah, because it's not compensated.
Yeah, because it's partially compensated, right? A stable COPD patient tends to be compensated, right? Okay. COPD exacerbation. Something has exacerbated this patient and they're no longer able to compensate, right? Fully. So now it's pushed them into partially compensate. So this ABG is most consistent with a COPD exacerbation. Does that kind of make sense there? Okay, good. All right. Let's just do one more. How are you guys feeling with this stuff here? Feeling pretty?
We don't know what tomorrow will be another day.
What's that?
We don't know what we're
Okay.
tomorrow.
All right, good.
So I think soon it was over my day.
Good. Good. All right. So, let me give you guys some.
Because they're dead.
So here we are. Opioid overdose. How about methamphetamine? Methamphetamine use, recent methamphetamine use, and asthma attack. All right, there we go. So these are the potential problems we're up against. Okay, so let's do. Okay, so pH. Acid, base, normal, acid, normal, base, normal. Okay, so it's full on acid. Good. Okay, PaCO2, acid, base, or normal? Acid. Bicarbonate, acid, base, or normal? Acid. Okay. So, do we have a problem? Okay, what is the underlying problem? Acidosis, good. Okay, and what kind of acidosis? It's a mixed, right? Mixed or combined acidosis. All right. So let's move down. Let's start an asthma attack here. What would you likely see with someone having an asthma attack? Depends how far along they are.
Uncompensated?
Huh?
Something uncompensated?
So in the early stages of an asthma attack, you will actually see an uncompensated respiratory alkalosis. Because what happens early on in the asthma attack? They get anxious, they start breathing faster, deeper than normal, right? And then later into the asthma attack, when they start air trapping and they start to deteriorate, then they go into an uncompensated respiratory acidosis. Does that make sense there? Okay. So this doesn't really seem to fit with an asthma attack. Recent methamphetamine use. What would we likely see with recent methamphetamine use? What is a patient probably going to look like when you assess them? How are they going to be acting?
Depends on if it's an overdose or if it's just use.
Yeah, so let's say they just recently used it. They're not necessarily overdose, but
Maybe going 100 miles an hour.
okay. So would you expect them to be a little excited? Okay. So what would you expect with their vital signs? Increased heart rate, increased respiratory rate. So what does that kind of seem like? Yeah, that would be, either an uncompensated respiratory alkalosis or maybe a normal ABG if they did need to use just a little bit.
Yeah, we
Just a little bit. So does this seem to match that though? This doesn't really seem to match recent. Okay, how about opioid overdose? Well, would you expect to see a respiratory acidosis? Would you expect to see a respiratory acidosis with it? Yeah, that's actually what you expect to see an uncompensated respiratory acidosis, right? Well, this doesn't really seem to fit there. How about a CPR in progress?
Yes.
Yes. This would fit that, right? A really sick patient, right? Someone who is really super sick. They have gotten sick to the point where they've gone into cardiac arrest. And like we said, the mixed acidosis, it tends to indicate a very, very sick person, right? So CPR, right, cardiac arrest patient, this would maybe match up better there. Does that kind of make sense? You guys okay with that? Cool with that? Excellent, excellent. All right. Well, tell you what. If you guys go onto Canvas